Good day, everyone. Welcome to Milani Bongani ML. This is our fourth episode. So, as you know, we started with Benedict Umhlongo. Then we also touched on clinical social work. Today we have Dr. Ace with us. So we'll start with our first episode on codependency. I will let Dr. Ace introduce himself and then we can start.
Okay, good day and thanks for having me. My name is Ace, but popularly, if not affectionately known as Dr. Ace. I'm a psychologist here in Sentin, where I'm running my private practice under the name Psychologist. And I've been the field of psychology for 4 years plus now. And before that, I started from the field of social work. And then I just drifted to psychology, kind of going deeper into the psychological functioning of people.
I think that's very interesting because our last guest was the other way around. She was a social worker and then not moving into clinical psychology, but more into counseling. So that's why she calls herself a clinical social worker. So it's the other way around. So as I mentioned, we're talking today about codependency. It is a topic that I recently got aware of as I went through my therapeutic journey. What I understand about codependency is basically a dysfunctional relationship, whether it is a romantic relationship, whether it is a relationship between friends, but I think it can also extend to a relationship into family, between brothers, between cousins, or between parent and child, or between parents. I know there's the caretaker, which is normally called the codependent. I've learned about the dependent, which they say takes advantage of the caretaker, but also the reason behind the caretaker is there might be signs of lack of self-esteem, trying to keep hold of their relationship. Sometimes they believe they are caretakers, that's what they were born to do, but sometimes they minimize themselves for the other. They do more than what they're supposed to do for the other, to please the other, people pleasers. But that's what I so far got to understand and read about the warning signs, the symptoms. So my first real question to you is, like, really from a psychological perspective, can you explain to the audience codependency first, and then codependency versus dependency?
All right. It's quite an interesting, but to just give a background when it comes to that. From a psychological point of view, codependency is a psychological trait. It's a personality trait. It's an interaction between two people. But if we take from psychology, whether we take the International Classification of Disorders, where we say the ICD-10 and the ICD-11, as well as the DSM-5 and DSM-4, the Diagnostic Statistical Manual. So codependency is not a diagnosable mental disorder, and neither is it a diagnosable medical disorder.
But would you say there is some not mental disorder, but mental aspects that play a role in it? Like, for example, as I mentioned, might have a lack of self-esteem. You might, I don't know, lack of self-esteem. You might be depressed, and you just want to, like, is there some mental aspect behind it, behind the psychological trait, as you mentioned.
So what happens is when there's this certain psychological benefits, there's a certain level of psychological comfort where the codependency benefits the two parts that are involved. But also, before I move to that, to just give a background, with the issue of codependency, when it started, it was primarily within addictive behaviors, and wherein it was even traditionally within, let's say, it's a family, where a family has a family member who has addictive behaviors to substances. And what is it that the family members are doing to kind of perpetuate rather than take the person out of the addictive behaviors? So when it started, it was around those issues, and that was 1940s and 50s. And then a lot of research and interest developed as a result of that to say, codependency, can it only be exclusive to the issue of addictive behaviors or within a familial situations, or it can also extend up until now? When we say codependency, what comes to mind generally is romantic relationships.
Yes.
But there could be a codependency. Let's say it's a family where there is father, parents, and siblings, and one sibling is an addictive behavior. How the family members respond to the addictive behavior of a family member can result in codependency. So there can be codependence between a family member and the entire family. It is not necessarily between two people. That was the historical origins of it. But with the research and stuff, it kind of shifted to looking at romantic relationship on two individuals. But it could be society against one individual.
Okay. So what is the warning signs of codependency?
Codependency, remember, it's within, let's say for this context to understand, it's within two people. Let's say in the context of romantic relationships, where you find there's one partner and the other. And just for us to understand, maybe for this context, we need to understand there's the issue of codependency, there's the issue of interdependency, and there's an enabler and the dependent one. So that moving forward, when we mean of an enabler, a caregiver or enabler, so the caregiver is the person who is kind of taking care of, who is kind of enabling the behavior. And then the dependent one is the person who is being taken care of, for lack of better words. And then when you speak of codependence, that's where that relationship is kind of one way, where one takes care of the other. And that's where it becomes a very toxic dynamic. But we cannot shy away from the issue of interdependence to say in a romantic relationship, we have to be somehow dependent on each other.
But what if the other one didn't ask to be taken care of?
The other one did not ask it.
Yeah.
Taken care of. So
because part of your explanation was there's the one being taken care of.
Yeah.
I didn't ask for you to come bring breakfast in bed every day, and then I didn't ask for that. I could have gone and make it myself, or I didn't ask, I don't know, for you to send me an e-wallet every week. I didn't ask for that, so I'm being taken care of. But how's that? Is that me taking advantage?
So what happens? Remember, I spoke about the caretaker and the dependent. So the caretaker, for example, we will unpack that as we move on, has got a psychological predisposition, has got a personality predisposition that entails self-sacrifice, not expressing one's needs and emotions, whilst focusing on the other person's needs, whilst focusing on trying to fix the other person.
Is that noble? Or is that, what is the stuff behind that? Trying to fix, trying to self-sacrifice. Is that noble, or is that, like, again, the other person didn't ask, maybe, or there's maybe not as much wrong with the other person, but is it noble from the caretaker to self-sacrifice and take care of, they feel they need to take care of the other person? Is that noble, or is that what more behind?
For them, they unconsciously so they are thinking of they're doing the best. I'm the fixer in a relationship. Should we be in a relationship? I'm the fixer. Should we be in the relationship? I'm the provider. I'm the more mentally stable one. I am the sane one.
But then they are being exposed to stress. They're being exposed to being more likely to become depressed or to become angry. Or so. What would you say to that?
With the issue of the codependence itself, what the caretaker won't understand is psychologically there is a void. Psychologically, there is a benefit that they are getting, and that is unconsciously. But outwardly, there is a lot of frustration. There's a lot of toxicity. So now with that doing, for example, it could be a void in childhood. It could be self-esteem. It could be a narcissistic, but we will come to the issue when it comes to personalities that might be susceptible to the issue of being either the caregiver or the dependent one. So coming to the other question that you asked is, within the interaction with the relationship, there is no people consciously sitting down to say, hey, in this relationship, I'm such and such and such, and I want to be dependent. You are such and such, and you're going to be the caretaker. As the dynamics of the relationship happen, unconsciously, each person find themselves assuming the role of the dependent and the other one assuming the role of the caretaker. So who starts? It depends. It differs from one context to another. You might find that when they start from a neutral platform, you may find there's one person who has got a caretaker tendency, who kind of pushes the other one into being a dependent. Or you might find there's this other one who has got a dependent tendency and who sucks the other one in to become the caretaker. But unknowingly so, and a lot of people who are in codependent relationships, they're not even aware of it.
Or like sometimes when you say that when a dependent sucks in almost the codependent, it's almost like when people are saying the one is needy or they irresponsible. So you mentioned addictive in the beginning about the 1940s, but sometimes the dependent brings the one in. Either they're needy or they're irresponsible, they don't have the financial means, I need to help them with their dream. So my thing is, who's likely to stop this codependency? Is the caretaker most likely to stop it, or is it the dependent? Because sometimes, as I mentioned, the caretaker might be, let's say someone cheated, for example. Yeah. Now because they cheated, they're trying to do so much more, and then they're trying to do so much more just to make up to the dependent. And then after a while, the dependent says, no, man, you've lost yourself, and it doesn't feel like we are in this relationship together. So now we're breaking up. So at that time, the dependent stopped it because they felt like the caretaker was doing a bit too much, but also losing themselves, and their lack of self-esteem and their lack of confidence is now ruining this relationship. So at that point, the dependent. So can the caretaker or the codependent also stop that relationship?
So when it comes to that, like I'm saying, it could be an either. One, the caretaker instigated the codependency, or the dependent instigated the codependency. But what so happens is, as long as these two parties find comfort, find the psychological benefits rewarding, it's not going to stop. So it's very possible for people to say they've been married for 50 years in a codependent relationship, because one is enjoying the caretaker role and the other one is enjoying and comfortable with being the dependent. So usually what makes it stop is at a time when the other develops a sense of awareness and insight to say, no, wait, what is going on here?
But how do they get there? What caused them, unless they went to go see a psychologist, unless they booked a session with you, and then you guys were talking, and then they got that awareness? But what if they didn't go to a session with you or to any psychologist or social worker or psychiatrist? Where do they build that level of awareness? Is it through their friends or family? But then those people were there the whole time already when this codependency, dependency thing was happening.
Of course, like you're saying, in most incidences, you'll find that the awareness and insight usually is brought up within a therapeutic environment. But usually the awareness itself, the person becomes aware, but not knowing it was actually the codependence issue. So usually what happens, the insight comes with this level of discomfort to say, I have been doing this too much, or I have stretched myself too much. I can't do this anymore. When they feel like the act of being a caregiver, the reward, it could be the financial or the psychological reward, if it is paired against the act itself, where they feel I'm overstretching myself, that's when they could be. Or on another note, where the dependent feels like the caretaker is become now too controlling and overbearing, where you say literally I can't make, where you feel like you are too much into my space. That's when. So usually it's not necessarily awareness, it's about discomfort.
So when that awareness or discomfort is being realized, or that insight is received, is it an immediate ending to that codependency dependency relationship, or does whoever instigates it or gains the awareness or insight starts a process of let's work through this, of first highlighting it to whichever party it is, and then say let's start the process, or it's like let's just stop it and let's just end it. And what would your advice be? Would your advice be just to stop it immediately, or no, let's make the other party, whether codependent or dependent, aware, let's work towards it, let's find the best solution work towards solving it, or do we just stop it?
So there are two outcomes that are usually happens, because remember, the codependence, it continues to be an interaction of toxicity, where at times the toxicity, when it escalates to such an extent that one part, like I say, maybe the dependent feels like the caregiver is overbearing and too much and too controlling, or the caretaker feels like I'm really overextending myself to sacrifice, to take care. So what will be important now is the one who has sensed discomfort first is to make the other part aware. To say, hey, I feel like I have been a caregiver, or I've been the Mr. Fix-It in this relationship. Probably you are irresponsible, it's careless mistake, you live a daredevil life, and I've been always found to reprimand or clean up your mess. And I'm tired of being a fixer, or Mr. Fix-It, or Mrs. Fix-It. Can we have a conversation about this? But once you trigger that conversation, now it depends on how the other part receives it. You might find where, for example, a person complains to say, I find you to be too controlling, too overbearing. Give me some space for me to take responsibility for my action. And the other person said, oh, you say I'm controlling, I'm overbearing, I've been doing 1, 2, 3, 4 for you. Actually, you're being ungrateful. And once there's such a response from the caretaker, it's kind of a psychological manipulation to put you back and perpetuate the codependency, because for them, it's still feeding who they are.
So we spoke about, earlier you mentioned personality traits, and then you used the word toxic quite a lot. And I think in pop culture today, the word toxic is being used a lot, especially when it comes to relationships or friendships even.
Yeah.
So the personality traits of can you delve a bit deeper into that? Or is it just like mainly toxic?
Now, with personalities generally, it's looking within the realm of codependence issue. It's usually the narcissistic personality, the borderline/bipolar, as well as the dependent personality. So, for example, you might find the caretaker, having a narcissistic personality, where controlling, fixing, seeing problems in others is what feeds their ego, whilst running away from their own brokenness.
Can I ask, can anxiety not also be one of the traits, especially with the caretaker, in case because they're scared of losing the dependent, now they overextending themselves?
It is the issue, like you mentioned, the anxiety, fear of abandonment and stuff. But if I may continue from what I was saying, the narcissistic personality, he feels, and now what you need to understand, there's nothing wrong with being narcissistic, because there's a personality trait and a personality disorder. So you can be a narcissist and not disordered. You can be borderline and not disordered.
Can you explain that further? Because it's very hard to understand it for me. Now, hopefully, the audience understands it better than me.
So, when we speak of narcissistic traits, you have traits, but those traits are not, for lack of a better word, severe, or the number of traits that you have around narcissism do not meet the criteria of being diagnosed as a disorder. And if you may check, like, for example, most businessmen, most CEOs, most sports team captains, most politicians, a lot of musicians, they are narcissists.
Okay.
And as long as you're not disordered, remember we have got 10 personalities, and each human being has at least one personality trait or disorder, or trait and disorder. So there's no escape when it comes to that. Each human being has got a personality trait. You've got narcissistic traits, or antisocial traits, or dependent traits, or borderline traits, or schizoid traits, schizotypal traits, and so forth and so forth. So when it comes to the codependency point, like I was making, let's say it's the narcissist who is a caretaker. So caretaking, fixing people, being in control, being a caregiver, it feeds the ego of the narcissist. And in them feeding their ego as well, as they focus on taking care of yourself, they kind of shy away and avoid their own brokenness. So if I stop looking into your faults to caregive and fix you, then I might be forced to start looking into myself, and I'm not ready to face my own brokenness. So let me focus on you. And hence, I continue perpetuating. Even we can be married for 90 years. As long as I'm perpetuating that, it's feeding me. I'm deriving psychological rewards from that, and we keep it like that.
What are the key detriments to this type of relationship? So when I mean emotional abuse, even even like murder, what are the detriments of hatred, stress, going into a nervous breakdown? What are the detriments, and what are the most severe detriments?
You know, when the issue of codependency, where it starts, somebody said it's about knowing where you end and where your partner begins. So now the issue is, when it comes to the main issue around codependency, is about boundaries. I can be responsible for you to this limit, but from there, no, you should take responsibility for you. I can help you, but to this limit. I can self-sacrifice but to this limit. So now with the codependency, now is there could be lack of boundaries when you don't know the psyche, my. Remember, in a relationship, it's two people. Although we one, but there's a level of individuality. So in codependency, people kind of lose each other. They kind of melt into each other such that there is no boundaries. I want to know, what is it that this is about you, and now this is about me. And the boundaries continue to blur. So that is the detriment of that. Boundaries tend to blur.
So then, so far, like there's three things that I've noticed that can help. So again, it is boundaries. Boundaries you mentioned. I think communication.
Communication and
yes.
Assertiveness, yes.
Yes, and assertiveness.
Mm-hmm.
Yes. Awareness and insight.
Yes.
So you can, however way they flow, but so far I've learned those are the things that is needed. And then once those boundaries are set, the awareness and insight is achieved, the boundaries are set, the communication is set there with assertiveness, then there needs to be then the solution. And if the solution doesn't work out, we need to end the relationship.
As we speak about the issue of boundaries, like I said, now coming to, like you're speaking, the effects of this codependency. Number one, the boundaries, they blur. Nobody knows where I start and when I end the relationship. There's kind of a fusion, kind of an engulfment between the caretaker and the dependent. And also adding to that, now what happens is there's a lost sense of responsibility. And it's something we use loosely when someone says, I know myself, I'm just a daredevil, but my husband is a Mr. Fix-It. No, I know myself, I'm reckless with money and this and this and this. My husband is my wife is a Mr. Fix-It. It's Mrs. Fix-It.
But isn't that, how they say, opposite attracts?
Yes, it does, where there is, remember, when your wife taking responsibility when it comes to your financial behavior, it's her taking part in giving you insight and correction and being assertive for you to be responsible. Not that you, because now with the codependence issue is you completely give away and the other part completely takes care of. So in the result, a sense of responsibility is not in you, because you know my partner will fix this, my partner will take care of this. And in the end now, the caregiver in trying to fix, in the end, actually nothing gets fixed. In them caregiving, thinking I'm fixing, inadvertently so they're being an enabler. So they continue enabling that behavior rather than being assertive and challenging you to change, to say, you've got 1, 2, 3, 4, 5, and I'm overstepping to clean up. Please, here is what I'm going to end. When it comes to this, take responsibility, clean up your mess. I'm not going to do this. Then you're being challenged to grow. But if they keep quiet and continue fixing and controlling it, you remain where you are. So one of the challenges when it comes to codependence is the lack of growth between the two, because the problem persists, it doesn't get fixed.
Okay, so we've identified now, like the process of reset, communication, awareness. So then what is the best way to solve it? Is it because do you believe that two people, again, we mentioned everything all the way up till communication, is enough to solve it between them? Or you go to couples therapy, or there's an intervention, or you go, if you're very big into faith, you go to your faith leader, or you go to your elders if it's culturally, or you go to therapy. What ways are there to solve it? Or do you think the two people who are in this relationship with the toxic traits, with the narcissistic, although they've identified all the ways and the commas were there at the end, like what who should be brought in, or what should be done to because almost as a third party to now really remedy the problem and create a new solution for the relationship to be more healthier.
The challenge that happens, like I highlighted before, is usually when this codependent relationship is established, you might find one part, either the enabler or the dependent one, has a subclinical to a clinical pathology, where you might find, indeed, for example, a person has got an addictive disorder, or indeed they have a borderline personality disorder, for example. So now the challenge that happens is, whoever sees the toxicity of this codependency and brings to the attention of the other is usually the one who is not pathological. But the one who is pathological, once it's raised, rather than seeing it as a challenge and growth, they see it as an attack. Let's say, for example, you, in the case where you're the caretaker, and maybe the dependent is the one who instigated this codependent interaction, and they've got a bipolar personality, a borderline personality disorder, for example. And now once you mention to say, no, I'm tired of taking care of this, I'm tired of this, you need to be responsible, you need to be. Once you start challenging them, rather than seeing it as an opportunity for growth, they see it as a threat to the relationship, as a threat to you saying I'm not worth, as a threat to you leaving. So in the end, usually, once the other parts start speaking about how much they're feeling the toxicity of the codependence, you might find the other one, there's a lot of denial or lack of insight. So it is in very rare instances where there is a shared level of insight and willingness to fix. It's one party that has got an issue. The other one, which has got subclinical or clinical pathology, they will be in denial and they won't want to see and they want to perpetuate the situation as it. So in the end, the one who developed insight and raised the issue, you are the problem.
Yeah, but the one who raises the insights doesn't know that the other one has a clinical issue. They don't know that they're bipolar, because someone might just be up and down, but they don't know they're bipolar, and the one party is not a psychologist or a doctor, or they don't know the DSM, or so they can't diagnose. So then what happens in that case? Because now you have one who's bipolar or has any clinical issue, but the other person is not a trained psychologist or even a counselor to identify it. All they have done is gained insight and awareness, but they didn't know it's because you are bipolar, that's why you're like that.
So now the issue usually with people coming for couples, I see a lot of couples. Before a couples consult with anybody, it could be a counselor, pastoral counseling, or a psychologist, there's usually people come for therapy after they have tried to resolve the issue. So even a person coming for individual, there's no person who comes without having put effort. In general, people come for therapy after 2 years or so, or if not more, of depression, 2 years or more of anxiety, or 5 years or more of relationship distress in marriage. That's one way they come. So the point of departure now is whoever has the insight and wants to break this toxicity has to bring it to the attention of the other and try and have a conversation. But in most instances, for it to work and be resolved between the two of them, it's usually a challenge. That's when they say, okay, we have tried to speak about 1, 2, 3, 4. How about we go to consult? But never run the risk of not reporting, not raising, not communicating with the partner, and running straight for outside help. It might be a very great problem to say, oh, so you see the problem so much that you couldn't even see me sane to speak to me. So point of departure, if there's anything you want to end, speak to your partner first. Let's have conversation. After you have tried, that's when you said, okay, between the two of us, we have exhausted our efforts. How about we look for outside help? And most instances, mostly professional help will be.
Cool. So I think I've learned a lot today about codependency. I think I learned, again, as I mentioned, about gaining the insight, the awareness, raising it, communicating it, being assertive, and then looking for the solution. I know the one party might have a clinical issue, but they might not know. But then the caretaker might also have narcissistic traits, but it's not enough to be diagnosed as well. So at the end of the day, it's all about following the process, raising the awareness, seeking the outside help, being open to listen to each other, and then maybe we'll get less breakdowns in relationships, whether it's friendships, less what's the word called, less disharmony in families, less disharmony in friendships or breakup in friendships. It's nothing like when a friend says, I'm the one who always pays, but but I've learned a lot. I think it's really something I never knew about codependency, and I think you've broken it down for us, like very nicely, and I would implore the audience to like just read more on it. But I would just like to give you the final word on just giving you a summarized thing on codependency, and also where people can find you if they need any assistance.
And okay, to just in summary, when it comes to the key issues we need to understand, codependency itself, it's not a psychological disorder. There is no diagnosis. You can never be diagnosed with that, but it's just a trait. And there was even a researcher, I think sometime in the 1970s, who tried to push for it to be diagnosed as multiple personality. So it's about traits which could be clinical or subclinical pathology, where the dynamics of codependence play within which. So when we resolve the issue of codependency itself, it's just peeling off the shells, if we put it like that. So to say, no, you've got a codependence disorder, it's not. It's not a psychological challenge. And like I said, there's the issue of the dependent and the caregiver. So at times it's to just evaluate, am I being the caregiver? Am I controlling? Am I trying to fix? Am I enabling? Am I being the dependent here who said, okay, I'm going to sit back and not be responsible for my own self while somebody's always cleaning up my mess? So it's a common thing where the codependence is kind of a toxic. But now what happens is toxicity is only known by a person who has got awareness. So you might actually celebrate being a caregiver, not knowing. You might actually celebrate being the dependent one, not knowing. The things like I said, to say no, myself, I know I'm very reckless and I'm a daredevil, but my husband is Mr. Fix-It. He always clean up the mess. And you feel like, it's our way of connecting, but actually it's a level of codependency. And yeah, it's thing where one has to have insight. There should be communication, try to resolve. If not, you can come to us as psychologists. And like I said, I'm found here in Sentin, in Morningside, on 49 East Road, Morningside Manure, just down the road from the Wedge and the Client Office Park. And for those maybe easy contact, the WhatsApp number would be 078 185 6758, or just Google Nzika Psychologist. You will find us on Google, you'll find us on Facebook, you'll find our website when it comes to the services we offer and how to contact us. Everything is clearly articulated there.
Dr. Ace, thank you very much.
Thanks for the opportunity.
Thank you very much. Thank you very much. So yeah, guys, we learned about codependency, as the doctor said. It's not a disorder, but it can also lead to a disorder being diagnosed inside of it, because one party might have bipolar. So that is how it comes into the mental health space as well. Again, this is all about stigmatizing mental health, learning more about all of these different things, how we can fix our relationships, how we can better communicate and understand and gain insight and awareness. And I hope we've learned a lot today. This is it for this episode, and then the next episode will be on a very big topic that has become very prevalent in recent times, which is burnout. Thank you very much.